This discovery that bone gets bigger with injury is something that I noticed many years ago, actually 40 years ago, and started to realize I was able to change with this technique. But it was only in 2005 that it was discovered at the University of California, the actual mechanism that causes this, and they verified that literally bone gets bigger with injury and literally changes its shape. If you have bone that is bigger, it's putting stress on ligaments and muscles. Nothing's going to work properly. You're going to have joint stress, you're going to have tension, you're going to have pain. So it's a question of finding out where that deeper injury is, and it's often in the bone, but even the internal organs absorb that. So if you have, for example, you have organs inside your body that are full of fluid, and that, if you think of a water balloon hitting the floor, the water inside is very, very dense, so it also expands, but it's transferred to the organs and to the rib cage and your spine and your pelvis and even your head. Like we see a lot of people with head injuries as a result of that. And these are the kinds of things that we are able to correct. So you have to be able to detect where the source of the problem is in order to correct the symptom. So it's treating the source as opposed to the symptom. And that's something that most practitioners, even though they may want to do that, they don't know how to find that. And by checking the entire body, what we do is what's called a scan. We can detect these areas of injury because of its electronic signature. And that allows us to treat the cause of the problem. And it's very, very gentle, which is also nice. It's painless. It's easy on the practitioner and the patient. And when it's corrected, you get pretty rapid improvement. The body can then heal because it's under less stress. I often use the analogy of a car that's been in an accident, okay? So you may be driving along and then you hit the curb, all right? And if you hit it hard enough, sometimes the frame of the car gets twisted or bent. And you may not realize that, okay? So then you start noticing things are squeaking, the steering isn't quite aligned, your wheels are maybe wobbling a bit at high speed, and you go to the mechanic and he fixes all of those symptoms. He might do a wheel alignment, he might kind of put a little bit of lubricant in the gearbox, and things go along okay for a little while, but then they become worse and worse. And you're spending a lot of money getting all those little squeaks and rattles and things treated or fixed, but you realize this is really not solving the problem because I got to go again and again, and they keep on having to do the same thing. And so imagine then going to another mechanic where he says, wait a sec now, what happened? You hit the curb. Okay, you know what? Let's look a little further. He puts the car up on the hoist. He looks underneath. He says, look, he can show you where it's bent. You could spend the rest of your life fixing all those other problems, but they're going to keep coming back. If I don't straighten out that deeper problem, it's not going to fix the source of it. And so really this is about the frame of the body being injured. It's the deeper structures, often right inside the skeleton, often inside the internal organs. By correcting that, all the other things improve. Everything can heal. And the body's amazing. The body's not like a car. If you take stress off of those other areas, they will heal. They'll get stronger. They'll get better. I'm going to give you an example here of an injury that might have occurred down here in the hip. And when I take this area of restriction, if you'll notice by using her shirt here, this pull is transmitted through the body. And can you feel where that is over here? So that causes stress and tension in other areas of the body. For example, she'll feel this in her shoulder or rib cage on the opposite side. She may have symptoms here, but in fact, the restriction causing it is somewhere else. This restriction here, which is actually what we would call a primary restriction, alters the mechanics of many other areas of the body. Okay, so our goal today is to detect where these restrictions are occurring in order to help improve the function of her body. And so we have a device that we've developed along with some scientists at the University of North Carolina, which we call the matrix scanner. So this device produces a small electrical field, which is used by matrix repatterning practitioners. And so this device we apply to the body to determine where these restrictions are. What I'm going to do is just use her rib cage as an example here. As I place pressure on this area, I see there's a certain depth or restriction that's apparent here. And if I place this scanner over different parts of the body, I'm going to notice if there's a change in this restriction. In a sense, what I'm doing with this is taking the same example of a restriction here. If this was restricted here and I place the scanner over this area, this would cause a temporary release of this restriction, which would affect the entire body, and that can be detected anywhere else on the body. So just by using her rib cage here, I can actually locate the sources of these restrictions. And as I place this on different areas, so for example, right here, when I place this on her right thigh, I get movement in her rib cage. You can see that. Can you feel that, Danica? Okay. Now I'll take it away from there and notice what happens. Okay. What happens? It gets a little more restricted again. All right. If I place it on this area, on her opposite thigh, it doesn't change that. Okay. So I know that somewhere in this area there's a restriction. This could be right in the femur. It could be coming from her hip, which it appears to be doing. So that's quite a difference right there. If I take it away, you can see there's very little movement again. So I know that there's probably been an injury to her hip. In her upper rib cage and sternum, there's another area of restriction. There's another area of restriction here in her lower rib cage. And I'm checking her shoulders and arms as well. We now know that there are a few areas of restriction. And what I'm going to do now is check her hips, because I detected something in her right hip, and we actually can see differences in the size of these structures. So Danica, what I'm going to get you to do is just feel this bone here with your thumb and fingers. Just put your thumb and fingers where my hand is. Good. All right. And then I'm going to get you to feel this one. Okay. You feel the size of that one. That's all the way back there. Okay. So what she notices that is what we find all the time. When there's an injury to these deeper, denser structures like bone, it literally changes the shape of that structure and causes it to get bigger. And if I press on this area, how does that feel? Tender. Yeah, you can see the response there. Compared to this one, nothing. Yeah. So very often these injuries cause tenderness because, in fact, there's stress on the surrounding tissue. So muscles and fascia and even joint structures have to accommodate this change in the size of the structure, and they become irritated and stressed. The other thing that we noticed is there are injuries in this area, and that it coincides with the kinds of things we find very commonly, and that is due to the injuries to internal organs, the fluid-filled structures we talked about, and how that affects the stress that's transmitted to the rib cage. So for example, when I press here, do you notice that sensitivity? That's sensitive. This one might be a little sensitive, but not as bad, no. So this area on her right side correlates with an area around her liver, which in fact has now affected her rib cage. So when I push on the rib cage on this side, okay, you can feel the restriction there compared to this side. Feel the difference in flexibility? This side is very flexible. This side is very restricted. So when we talk about a primary restriction, we're talking about actual restrictions that occur in these tissues. But you can see the rib cage and even the fascia around the ribs becomes sensitive, irritated, and stressed. Now, because of the location of many of these internal injuries, this actually causes changes in the stress that's transmitted into the muscles and the ligaments and fascia. So, for example, if I check her hip range of motion, I'm going to check her range in this direction. You can see when I get to about here, it's somewhat restricted. So this goes to about 120 degrees, all right? And if I look at her range of motion in here, we have about 45 degrees. And this direction looks like we have a pretty good 40 degrees there, all right? So that's where she is without any other influence. Now, if I were to place the scanner on this area, just bring your arm out a little bit, thank you. This will temporarily reduce the influence of the injury in the rib cage. So with this in place now, I'm going to get you to lift your leg and let it relax, okay? All right? And this is the range of motion she now has. Okay, you can see the improvement there. Do you feel that? Okay. This restriction may be a little different. Okay. And if we look at the range of motion now in internal rotation, we have another substantial improvement. Okay. So symptoms are often caused by these internal injuries that limit ranges of motion, cause mechanical stress on joint structures, and so on. And that by demonstrating this to you, you understand now that if you had a problem here, this area could be part of the problem, correct? So it's very simple to explain to patients why you may want to treat other areas of the body in order to produce an effect, even before treatment is applied. So treatment involves very, very gentle pressure. So in combination with the instrument, which is applying somewhat of a normalizing influence, I can also apply a gentle pressure, which I will do now. Okay, so, and you can see how gentle that is, okay? And really what I'm trying to accomplish here is lining up some structures. I'm just going to do a little mini treatment here. That's going to cause a little bit of movement of the molecular structure a little closer together to allow the electrons to begin flowing again. We refer to that concept as piezoelectricity, which means pressure-induced electricity. And when that current is reestablished, the cell structures can actually return to their normal state. And one of the things we've noticed over the years is that correcting these structures not only improves the mechanics of the body, we've actually seen significant evidence that there's been improvement in various functional changes as well. For example, liver function. In this case, we see improvements in liver enzymes, cholesterol levels. We see improvement by treating the area around the kidneys in things like blood pressure. We've seen changes in cardiac function. And as well, the mechanical, besides the mechanical changes that take place. So I've done a little bit of a release there, okay? And we can actually check that in the hip as well, okay? So within a very short period of time, these changes are measurable and alter the mechanics to much closer to normal. Dr. Norman Doidge, who's one of the leading brain specialists who looks at traumatic brain injury, he wrote about matrix repatterning in his recent book called The Brain's Way of Healing. And according to him, and the things that he was able to document, he says that matrix repatterning is probably one of the first things that should be used to correct head injury. His hope is that it will be eventually in emergency departments because it's something that can be a very early intervention to correct serious concussion.